Today, we are diving deep into two conditions that, frankly, are still so widely misunderstood, even though they affect millions of people: endometriosis and adenomyosis. And we're going to look at them in a whole new way, not just as a period problem, but as the complex, whole-body diseases they truly are.
So let's just start with the biggest question, the one that so many people grapple with. You're told your disease looks mild, maybe after a surgery or on a scan, but the pain you're feeling is anything but mild. It's debilitating. So how on earth is that possible?
And look, this isn't just in your head. It's a known medical fact. This idea that what the disease looks like doesn't match up with what it feels like, well, it's one of the biggest reasons these conditions are so confusing, and honestly, why so many people get dismissed.
Okay, so that's our starting point. We're going to unpack this central puzzle. We'll get into what these conditions are and why there's this frustrating gap between what a doctor might see and what a patient actually experiences.
First things first, let's get our definitions straight because they are different. With endometriosis, you have tissue that's like the uterine lining growing where it shouldn't be, outside the uterus. With adenomyosis, that same kind of tissue is growing into the actual muscle wall of the uterus. So the key difference is location, outside versus inside the muscle.
Now, they can show up a little differently. Adenomyosis, for example, is really known for causing super heavy bleeding. But both of them bring a lot of pain and inflammation to the table. And here's the most important point on this slide, the one you got to remember. They often show up together. And that can make getting a diagnosis really tricky, because your symptoms might be coming from both conditions at once.
So if the size or amount of lesions doesn't explain how much pain someone's in, what does? Well, to figure that out, we have to look at the nervous system. Think of it like the body's master volume knob for pain.
And that brings us to this absolutely crucial concept, nociplastic pain. This is what happens when chronic pain and inflammation literally start to rewire your nervous system. It just becomes hypersensitive. So the pain isn't necessarily about new damage, it's about the system itself being stuck in high alert. And let me be perfectly clear, this is not all in your head. This is a real physiological change in how your nerves are working.
And this quote just nails it. It's the perfect analogy. Imagine a volume knob for pain in your body. With chronic conditions like endo and adeno, that knob gets turned way, way up, and then it gets stuck there. So even a small pain signal coming in gets blasted out at full volume. You know, a nervous system with the volume cranked to 11 doesn't just affect one spot. It explains this whole cluster of symptoms that so many people report. That crushing fatigue that sleep never seems to fix, the brain fog, the way a bit of stress can cause a massive pain flare, it's all connected. It's all part of this central sensitization.
All right, let's bust another huge myth. This time, it's about what endometriosis actually looks like. Because what many doctors were taught to look for in surgery, it isn't the whole picture, not even close. This is the classic textbook image, these dark, black, powder burn lesions. For decades, this was pretty much what surgeons thought endometriosis was. And if they went in and didn't see this, they might just say, nope, no endometriosis here.
But here is the absolute game changer. Most endometriosis does not look like this. And relying only on this one classic presentation is one of the single biggest reasons the disease gets missed time and time again.
The reality is that endometriosis comes in a whole spectrum of colors. It can be red and angry looking, which suggests it's more active and inflamed. It can be white or yellow, looking more like scar tissue. It could even be clear, like little blisters. A true specialist has to know how to recognize all of these different appearances to give an accurate diagnosis.
Okay, let's switch gears for a second over to adenomyosis. While surgery is really the gold standard for diagnosing endometriosis, adenomyosis actually has some pretty specific clues that a skilled technician can spot on imaging, especially ultrasound and MRI.
One of the most telling signs has this really descriptive name, Venetian blind striations. And it's exactly what it sounds like. On an ultrasound, you can see these fine, dark lines going from the lining down into the muscle, showing exactly where that tissue has invaded and disrupted things. It's a fantastic visual clue.
Here's a key number to know. On an MRI or a good ultrasound, doctors can measure something called the junctional zone. That's the border between the uterine lining and the muscle. In a healthy uterus, it's nice and thin, but with adenomyosis, it gets thick and blurry. If that measurement is more than 12 millimeters, that is a very, very strong indicator of adenomyosis.
So after all of that, what's the bottom line? Well, it gives us a completely new and much more accurate framework for thinking about these conditions, one that actually lines up with what patients are experiencing.
And here it is. This is the big idea we have to embrace. Endometriosis and adenomyosis are whole body diseases, and we have to get it through our heads that the stage of the disease does not equal the level of suffering. You can have a low stage and be in agony, and we now understand the science behind why that is.
Which, of course, leads us to the most important question of all. If we know the disease involves a haywire nervous system and a whole spectrum of appearances and systemic issues like fatigue and brain fog, then what does a truly comprehensive diagnosis and care plan even look like? It's pretty clear that just one surgery or one pill isn't going to be the answer for everyone. It really pushes us to think bigger.